Radhe Radhe to all, and I hope everybody is doing perfectly fine. So today we'll be discussing a very important topic, that is shock. In very short, actually, I'll just tell you in brief, touching each and every aspects of shock in nutshell. So basically, we'll be discussing about types, the different stages in hypovolemic shock, and what are the morphological changes which occurs in organs, different organ post shock. So how you define it? Basically, it is the state of circulatory failure. And along with the circulatory failure, what you have a profound hemodynamic and metabolic disturbances. And this leads to failure of circulatory system, which is not able to maintain an adequate blood supply to our circulation. And in turn, it is causing what? Inadequate perfusion of vital organs, and this is ending up in cellular hypoxia. So circulatory failure along with your hemodynamic and metabolic disturbances leading to circulatory failure, which is not able to maintain an adequate blood supply to our circulation, and in turn causing inadequate perfusion of vital organs. Vital organs are not able to get enough blood supply, and that is resulting in cellular hypoxia. Cells are not able to receive adequate oxygen. So now in nutshell, what are the different types? So there are basically three main types: cardiogenic shock, hypovolemic shock, and septic shock. So cardiogenic, as the name suggests, related to heart. So here what happens, there is a failure of myocardial pump, intrinsic damage to myocardium, and there is external pressure. So why there is a failure of myocardial pump? It could be internal cause, whichever is causing to damage to the myocardium. It could be some external pressure, or it could be some outflow obstruction. Then example, you can say pulmonary embolism, myocardial infarction, ventricular rupture. These are all heart pathologies, arrhythmia and cardiac tamponade. So all these can lead to your cardiogenic shock. Then hypovolemic shock. So as name suggests, something related to volume, fluid balance. So there is inadequate blood or plasma volume, and these can occur in your condition where there is extensive blood loss in patient, like in hemorrhagic conditions, vomiting, diarrhea, burns and trauma patients. Then third is your septic shock. This is also very important from a baby's point of view. Also, you get a short note on pathogenesis of septic shock also. So here what? There is a cascade actually. There is a interplay of many events which is leading to septic shock. So there is activation of cytokine cascade, there is peripheral vasodilatation and pooling of the blood, and this leukocyte induced damage, disseminated intravascular coagulation. So we can see septic shock in the conditions like your toxic shock syndrome, overwhelming fungal and bacterial infection, trauma, burns, or patients with pancreatitis. So this is a nutshell the layout of this septic shock. So in microbial products which are related to your toxins also, so they what do? They do activation of complement system, activation of coagulation cascade, endothelial activation and neutrophil and monocyte activation. So ये सारे activation क्या करते हैं? They lead to release of different kinds of interleukin 6 like interleukin 6, different kinds of interleukins like 6, 8, nitric oxide, platelet activating factor, reactive oxygen species. Then there is release of your procoagulant factors, antifibrinolytic factors. Then release of interleukin 1, interleukin 12, 18, tumor necrosis factor. So all these release will cause what? They will increase the vascular permeability, cause microvascular thrombosis and lead to systemic manifestation and ultimately leading into multi-organ failure. So now there are stages of shock. What happens in different stages? So we can, this hypovolemic shock होते हैं उसके basically three stages जो होते हैं वो outlined होते हैं. So first you have your non-progressive shock, then you have your progressive and then irreversible stage of shock. So non-progressive is what? The non-progressive है कि still it can be corrected. Like there is activation of a reflex compensatory mechanism होती है जो उसको overcome कराती है, which will try to maintain your cardiac output and blood pressure. They will try to maintain the perfusion, which is going the blood supply to the vital organs. Then there are neurohumoral mechanisms which are interplaying, like baroreceptors reflexes, catecholamine release, activation of RAS, and ADH release. So patient how presents with, there is tachycardia, peripheral vasoconstriction, and renal conservation of fluid. So all these are like here, they are trying to prevent the patient from undergoing to fatal shock. So the patient will, जब आप examine करोगे patient को, you will see there is a pallor of skin, cold skin, which is due to skin vasoconstriction basically. So then if non-progressive shock is not controlled with adequate blood supply or volume of fluid over a fluid load, giving fluid to the patient, so what happened? The patient can land into extensive tissue trauma, hypoxia. Then vital organs will be affected now. They will start failing to work. There will be intracellular aerobic respiration, which is replaced by, so now anaerobic glycolysis come into play. So they will increase your lactic acid production. What lactic acid will do? It will blunt the vasomotor response. There will be dilatation of the arterioles and pooling of blood into the microcirculation. So there is risk to the endothelial cells to develop anoxic injury, that is DIC, disseminated intravascular coagulation. So then what happens? The third stage is your irreversible shock. इसमें क्या होता है? There's a widespread cellular injury, culmination into death of the patient, and there is acute tubular necrosis, renal failure, and the patient will present to you with complete absence of passage of urine. And there is ischemic bubble. So what happens? Intestinal flora, they will start entering the circulation of the patient. Then this will cause added septic shock, microbial products, release of toxins. So now we'll see some changes, pathological changes which are occurring in your organs, vital organs in end stage of shock. So suppose first we're taking heart. So इसमें क्या होता है? There is systolic and diastolic dysfunction. So grossly when you see the heart, it will be petechial hemorrhages are there on the epicardium and the endocardial surface. Then microscopically what you will see, there is necrosis in myocardium, which will range from loss of your single fibers to large necrotic areas. There are prominent contraction bands. Then when we come to kidney, second organ जो affect होता है shock में, that is kidney. So kidney will be enlarged in size, pale in color. So that you will not be able to appreciate the corticomedullary junction properly. There will be edematous cortex. Microscopically क्या देखोगे आप? There is dilatation of the proximal tubule, focal necrosis of the cells. Then there will be loss of nuclei of tubular cells or apoptosis. Then there will be pigmented granular hyaline cast in the tubular lumina. So these changes we'll see in kidney. Lung will also show. Shock lung is very important. That comes as short note also. So how your shock lung looks like? It's heavy, firm, boggy and airless. It becomes hard. So lung, because why? There is accumulation of fluid and blood inside. Weight of the lung, of each lung will increase to more than 3 to 4 times of the normal weight. Then cut section, when you cut surface, what it will show you? Bulges and it oozes fluid out of it. And there will be petechial hemorrhages beneath the pleurals. So microscopically, what we'll see? Interstitial and intra-alveolar edema. There is formation of hyaline membrane. What is hyaline membrane? Alveolar wall surface पे what you see is a dense eosinophilic glassy lining हो जाती है. So what are those? Those are your precipitated plasma protein, cytoplasmic and nuclear debris of the shredded epithelial cells. And along with all these edema and hyaline membrane, you will notice congestion, you will notice fibrin deposition. So there are a few other organs where we see changes, like the gastrointestinal tract will show you diffuse GI hemorrhage. Then liver will be enlarged, cut section will be mottled appearance hogi usme, and microscopically we'll see central lobular congestion and we'll see necrosis. And pancreas will show you ischemic damage, release of enzymes, catalytic enzymes release hogi. Then brain will show you hemorrhage and infarct. Adrenal will show you hemorrhage and infarct. And there is a terminology, this is the Waterhouse-Friderichsen syndrome. What is it? इसमें क्या होता है? एड्रेनल ग्लैंड का एंटायर नेक्रोसिस, हेमरेजिक नेक्रोसिस होती है associated with shock, and this is why because of meningococcal septicemia. So this was a nutshell actually about what is shock, how you define it, what are the different types or mechanism of shock, then what are the different stages of a hypovolemic shock, and then what changes are grossly and microscopically, what all changes you can see in affected organs because of shock, end stage shock. So thank you so much for your patient hearing. Kindly like, subscribe and share my channel Patho with MK. Thank you so much.